So I'm Manoj, about 58 years of age. While lying down on my bed in the nights, I used to face breathing problems and while climbing stairs. So I knew something was wrong with my heart. It happened so rapidly that I immediately consulted Dr. Barbe.
He came to us with breathing difficulty. So I've been treating him for a long period of time and had implanted a stent in him about 7 years back. But then he developed kidney problems and was consulting a nephrologist. And since last 1 year, he started complaining of breathing difficulty. So when he came back to me, his serum creatinine, which is a kidney parameter, was very, very high. His heart pumping efficiency had dropped to 30%. And one of his valves, which is called the aortic valve, had stenosed. Stenosed means that it had become narrow.
Yeah, I've been tested here for COVID-19 twice, and they're very strict. They're very particular about wearing masks, sanitization of this thing. In ICU, well managed. But again, for a patient who wants to recover fast, ICU is not the place. And the rest of the staff, especially the ground staff, they're very, very courteous, very, very helpful.
So now you have a problem. You have a problem of a person who has a chronic kidney disease, very high serum creatinine, has a low heart pumping efficiency, has a valve which is completely narrowed. In the past, these valves were treated by surgery, but we elected to take a non-surgical procedure on him, which was called TAVI, wherein we replace the valve with local anesthesia, with the patient fully conscious and talking to us. The whole procedure is done through the groin like his angioplasty was done. And I was talking to him throughout the procedure, which took about an hour's time.
He operated me 2 days ago, and here I am, fit and fine, waiting for the discharge, maybe tomorrow.
So for this patient, we used a very nice and a special valve, which is called Evolute Pro. It comes from an American company called Medtronic. And this is the first time in Max that we used a Pro valve. Now, the Pro valve has another advantage, that it fits in so well into the aorta that generally there is no leakage or stenosis. Like in this patient, we had no stenosis or no narrowing and no leakage. So a perfect result can be obtained with such valves.
So for any patient who is suffering heart problems, I would definitely recommend Max Hospital and Dr. Balbir Singh in particular, because he is an excellent cardiac surgeon.